Welcome back, South Georgia. Welcome back, and thank you so much for sticking around. Well, if you didn't know, May is Stroke Awareness Month, and today Phoebe's stroke coordinator and neurologist is here to share life-saving tips and what we all need to know about recognizing the signs of stroke. So, ladies, welcome to Town and Country. I'm joined by Dr. Marla Morgan and Miss Regina Barnes. Welcome to Town and Country. How are you?
Doing well, thank you.
Awesome. So we're here to talk about stroke, just to bring awareness to our viewers in the community. So first, just starting things off, what is stroke and what are the most common causes of a stroke?
So a stroke occurs when you have interruption of blood flow, nutrients, oxygen to the brain. And that can happen from a variety of causes, including a clot, which causes an ischemic stroke, or bleeding, where a blood vessel bursts, and that will cause a bleeding type of stroke or hemorrhagic stroke.
Okay, now what are the warning signs of a stroke that people should know about?
Well, one is balance. If you have your balance is off and you have not been drinking, a lot of the eye drooping, face drooping, if you ask them to hold out their arms, maybe one of them will go down, slurred speech, they will have a face drooping, like maybe their face is almost looking like it's gonna fall off. A slurred speech, they sound almost like they have marbles in their mouth, and then a lot of times they will complain of a terrible headache. Terrible headache.
So if someone sees these signs, what is the first thing they need to do?
Call 911.
Okay.
Absolutely.
Call the ambulance. Don't try to drive yourself.
Okay.
Try to call the ambulance, because when they get to your home, it's like a little hospital in your front yard.
Okay.
And they are very versed in recognizing signs and symptoms of a stroke, and they can get you quickly to where whichever hospital you need to be in.
Okay, absolutely.
to
Now,
treat it.
what would you say are the biggest risk factors for stroke, and how can people lower their risk?
So we look at risk factors that you can modify and risk factors that are not modifiable. One that is not modifiable is your family history of stroke. So if you have a primary relative, parents, siblings, children that have had a stroke, you're at a greater risk for stroke. The things that you can do something about include diabetes, high blood pressure, high cholesterol, and smoking. So if you keep your blood sugar and your blood pressure under control, you keep your cholesterol at an optimal range, and if you smoke, you stop smoking. Those things can lower your risk of stroke.
Okay. Now, can you talk about the stroke care certifications that are meant for patients?
Yeah, so right now at Phoebe, we have the DMV stroke certification, and it just means that, we're serious about strokes. We have a specialized team that is activated whenever a stroke arrives, and we are using all of the evidence-based practices that is the latest evidence-based practices for treating stroke patients.
Okay. Now, as you know, technology is forever changing.
Yes.
So what advancements in stroke treatment are making the biggest difference today?
Telemedicine.
Okay.
Telemedicine for sure. A lot of times in rural areas where they don't always have access to fabulous neurologists, we can access the telemedicine, and the teleneurologist is almost like a neurologist being here, but it is online, and they can give orders on things to do for stroke. That's the one that I like the most.
Yeah.
And so in addition to having early treatment through teleneurology, we also have advances in terms of our medicines that we use once you have been identified as having a stroke, and if you get to the hospital early, there are some treatments that can help break up a clot, for instance, to hopefully help in your recovery. And there are some surgical procedures that are available now to help those patients, particularly those patients that have had an ischemic or a clot type of stroke.
Okay, and I think now one of the biggest questions is, can someone fully recover from a stroke, and what does that journey look like?
It really depends on where the stroke is and the size of the stroke.
Okay.
We do know that if you seek treatment early, that puts you in your best position for having the most in the way of recovery. We also really preach that even after you've had the stroke, that you're very aggressive from a rehabilitation standpoint. So it doesn't just stop in the emergency center or stop once you're in the hospital. That rehabilitation portion really helps you recover function.
Okay, now are there any support groups available at Phoebe?
Yes, we do have a stroke support group. We meet the first Wednesday of every month. And just this past month, Dr. Morgan came and spoke with all of our stroke survivors and the caregivers. And we like to get together just to make sure that they're not having any barriers. And sometimes they don't like to always talk about stroke. So
Yeah.
it's a good thing to do just to kind of help get back to their new normal.
Okay. Now, what would you say is one myth about strokes that you like to kind of nip in the bud today?
I'd like to dispel that myth that there's nothing we can do. I have patients and family members even who have had stroke symptoms and just tried to wait it out, see if I could sleep it off. And that is the absolute wrong thing to do. There are things that we can do about stroke in terms of recognizing the signs and having early treatment. There are new treatments that we can do, and there are things, again, from a rehabilitation standpoint that we can do to help you recover function. So it's not that you have a stroke and that's it.
Yeah.
You can really recover and make some good recovery. And so I think dispelling that myth that there's nothing you can do about stroke, you just wait and see what happens, that is absolutely the wrong answer.
Absolutely.
I would like to bust up, it's not just for old people.
Yeah.
It's not an old people's disease. It can also happen in young people too.
Wow. Okay. Now, what resources are available for those who are watching if they're interested in learning more about strokes prevention, other resources that are available at Phoebe? How can they get in touch with you all?
They can get in touch with us at the stroke support group. They can go to phoebe.com/stroke, and then you can get all the things on that website. And if not, you can also go to the American Heart Association.
Okay. Well, ladies, thank you so much for joining us here on Town and Country, and it was a pleasure speaking with you about stroke and just bringing awareness to our viewers and our community. So thank you so much for what you do.
Thank you.
Thank you for having us.
Of course, and we'll have all this information posted on our website at WAOB.com, but don't go away just yet. We'll have more TNC coming up right after.